Namaste and welcome everyone. I'm going to request Dr. Mahadevan, who is GCAR Board of Director, to get us started with today's program.
Sure. Namaste, everyone, and welcome to the Global Council for Ayurveda Research, GCAR Ayurveda Day event titled Emerging Research in Ayur Oncology. A few housekeeping items. Please make sure you have your phones off, or if you are on, please stay on mute and unmute yourself only if you want to ask any questions, or you can post the questions in the Q&A and the moderators will take them one at a time in the end. So let me quickly get started and introduce our first moderator, Dr. Pavitra Ramanathan, who's an MD, a resident physician, a radiation oncologist at Loyola Medical Center, Chicago. And she's also a resident physician, internal medicine at Advocate Lutheran General Hospital. She's actually worked in both Ayurveda and in modern medicine. And that's one of her unique skill set. And she has been involved in maintaining even an Ayurvedic pharmacy and promoted healthy living through Ayurveda. So please join me in welcoming Dr. Pavitra as one of our moderators today. Over to you, Dr. Pavitra.
Thank you, Dr. Dhanvantari, for giving me a short intro. Now I'm going to start the event for the day with a Ganesha invocation. So I'm just going to pray, and you can just pray along if you want. Gajananam Bhutaganaatisevitam Pavithajambhu Valasarabhakshitam Umasutam Shogavinashakaranam Namami Vigneshwara Padapankajam. Now I'm going to invite Dr. Pratibha, who is our founder and president of Global Council of Ayurveda Research, for taking further with the welcome address. Thank you.
So, wishing everybody a very happy Diwali to start with. It's been our Festival of Lights just 2 days back. And I welcome you all to this effort that we are putting together for a dialogue, for a conversation, to bring a spotlight on the integrative approaches, efforts, steps, any innovations that are taking place in the integrative field on approaches to cancer care. And we hope today is going to be a very productive session. We have some really esteemed experts around the world here on the panel. So thank you for taking out the time to join today. Before we get started, I'm going to share a little bit about the organization. So bear with me as I just bring up the slides. Just in very brief, just a few words, just a little bit of a background about the organization, some milestones and where we are today. So GCAR was founded in 2012. And after several years of existing and doing some grassroots work with a lot of passionate, interested people, ultimately in 2017, we got registered as a formal 501c3. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. And our mission in doing so is to encourage, educate, and facilitate basic, clinical, and interdisciplinary research in Ayurveda. Right now, we have on the board myself, Dr. Pavitra Ramanathan as the secretary, Dr. Mahadevan Sitaraman, and Dr. Shraddha Ravani in the board of directors. GCAR is a 100% volunteer-run organization. So at this point, I would like to give a call out for volunteers. If you have some time and the passion, please do email us. Go to the website. You can contact us from there. Or our email is ayurvedaresearchusa@gmail.com. Very easy. Please contact us. And last but not the least, very, very important, we are again a 501(c)(3), I want to remind. So we really depend on donations. So if you can donate any amount, that will be very much appreciated, because no amount is small. It takes a village to run a nonprofit. We have a lot of back-end recurring expenses. So any amount that you can donate is really appreciated. So please do consider that. Our website is right here. Just a few very select milestones. We have been invited as an organization to present research-focused workshops at different national and international Ayurveda conferences. We have been represented at the Integrative Medicine Symposium at Harvard for 3 consecutive years. Right now, it is not being held, so we have not been able to participate. We have been able to educate Western clinicians about the principles and fundamental concepts in Ayurveda. We have been able to educate Ayurveda practitioners about case study documentation as a suitable research method, and also how to publish, etc. We conducted a national survey in India on COVID awareness in 2020, and it was published, and it was also sent as a report to the Ayush Ministry. Um, the other things that we do are mentorships on case studies if we are contacted by anybody who's interested. We run monthly journal club meetings, which are really, really important in inculcating a critical eye. We also run monthly global webinar series, which are a little more general but academic in nature, not research focused necessarily, but they do always have some research inclination. And we bring a variety of experts in these series. If any one of you who are interested in participating as a speaker in either of these monthly endeavors, please contact us. We look forward to getting new speakers every month, so that we can widen our perspective. We also have a quarterly newsletter, which has crossed 2,000 subscription at this point. We have published an article in JAME. We are part of the National Consortium of Ayurveda Medicine, and we have organized a successful national conference in Orlando last year. Most recently, we have launched a podcast on cancer and Ayurveda. The first episode has been recorded by one of our esteemed panelists here, Dr. Nitin Kochar. And this is going to be a quarterly podcast. You can stay tuned for more details. The podcast will be published very soon. And before I go into the last milestone, we do have other numbers that are representative of people being interested in our kind of work. We have 8,000 plus people in our social media groups, and on our YouTube channel, we have crossed 100 videos now, and we are almost touching 800 subscribers. So please do check out our YouTube channel and subscribe. Subscribe to our newsletter, which is quarterly. Again, we don't spam your inbox. And last but not the least, just 2 days back, I was privileged to be representing the Global Council for Ayurveda Research in a very historic initiative at NCCIH, where they have formed a coalition for whole person research. So this is, we've been hearing this buzzword, whole person research, for, I think in my own experience, 20 years almost. But now finally, we have a formal coalition for whole person research, and many, many, many stakeholders were there. So it was a matter of privilege for us to be at have a seat on the table. And many positive updates are likely to be coming out in the next coming days. So please stay tuned. And once again, thank you for joining us today. Now, we will get started with our panel for the day. It's an extremely, extremely important effort. We are doing two things here. First, we are holding this very important panel discussion on a very significant day, or rather celebration of a very significant day, which was on October 29th, technically. We celebrate Dhanvantari Day, Dhanteras, Ayurveda Day, on 2 days before Diwali, and we are trying to use this landmark day as an opportunity to bring awareness about Ayurveda. So I do want to mention that this is in celebration of Ayurveda Day, and we hope more awareness is built on Ayurveda worldwide. And then second important thing is the topic of today, which is emerging research in Ayur Oncology. And if you have not heard this term before, please forgive us, because it is probably a term we have coined, or maybe we have picked it up from somewhere, but we just came up with this term, and we hope this term catches up, and we will probably have some commentary on the nomenclature itself. But it is the other things that we are really excited about to hear from our esteemed panelists. So let's get started. I will hand over the mic to Dr. Pavitra, and once again emphasize that cancer care is a really, really important topic. We all know what a disease burden cancer care causes on the healthcare, and we still do not have good solutions. And it is time to look outside of the box, which could be the box of conventional care, standard care, whatever it is that we may want to call it. And this is probably a start. Maybe we might hold a series of these kind of panels on cancer care, because it's a very, very important topic, and we really need to start looking at everything that is out there which could add to the care toolkit, and maybe make cancer care more and more effective, if not cure, but at least the care. So with that, let's get started. On to Dr. Pavitra, please.
Thank you, Dr. Pratibha, for a brief note on what GCAR is doing, and then I'm just waiting for the slides to come up. So please give me a few seconds, a minute. I'm still not able to share, Dr. Mahadev.
Okay, let me give you.
Yeah, you have to make.
Yeah, I will make a co-host. Sorry for the little delay on the technical side. Let me bring up your name. Go ahead. Can you unmute?
Sorry. Hope you're able to see. Okay. It's a pleasure to introduce our panelists for today. First, I'm introducing Dr. Santoshi Narayanan, who's an MD, FACP. She's a compassionate, board-certified internal medicine physician who has made significant contributions to the field of integrative medicine and oncology. In 2015, Dr. Narayanan joined MD Anderson Cancer Center, co-founded and served as the Associate Director of the MD Anderson Onco-Hospitalist Fellowship Program. Driven by her desire for a whole-person approach to address unique needs of cancer patients, she transitioned to the Integrative Medicine Center in 2018. Her focus revolves around incorporating various aspects such as diet, exercise, mind-body approaches into the treatment plans of her patients and counseling on supplements. Dr. Narayanan is a co-author of over 35 publications and multiple book chapters, and her expertise and insights have been sought after by numerous national and international conferences where she has been invited to speak as an expert in the field. It's an honor and pleasure to welcome you, Dr. Santoshi Narayanan, for this panel discussion here.
Thank you very much, Dr. Pavitra. And thank you very much, everyone, for having me here.
I'm going to introduce Dr. Nitin Kochar. He's an MD in Ayurveda. He's a consultant at KEM Hospital, Mumbai Health Center, University of Mumbai. He's an Ayurveda consultant at Srimati KG Mittal Punarvasu Ayurveda Hospital, Mumbai. He's a recipient of the prestigious Zandu Dhanvantari Award for the year 2015, Times Leaders in Healthcare Award in 2020-21. He has done a certificate course in endocannabinoid system and therapeutic targets by the Society of Cannabis. He has a certificate of GCP to be an investigator in clinical trials. He worked on clinical trial on efficacy and safety of turmeric on bone cancer. It's an honor and pleasure to welcome you, Dr. Nitin Kochar, on behalf of GCAR.
Yeah, thank you very much for the opportunity. A slight correction. I was working in KM Hospital till 2016. That's it. Yeah,
Oh,
rest all
okay.
Yeah.
Okay. Sorry about the information. Next, I move on to Dr. Vinita Deshmukh. She's an MD Ayurveda and a PhD in Ayurveda as well. She's current roles as Deputy Director of BSTT's Integrated Cancer Treatment and Research Center, Bagoli, Pune, since 2011. She's also a professor and HOD at Samhita Siddhant and Sanskrit Department, BSTT's Ayurveda Mahavidyalaya, since 2010. Her academic achievements includes, apart from the degree that she has an MD Ayurveda and PhD, she has completed DSc in 2021 and breast cancer with an Ayurvedic perspective. She also holds an MA in Sanskrit 2003, a PGDCR 2006 from the Institute of Clinical Research of India. She has been awarded Jeevak Award by MP Nanal Foundation 1993 and a Vaidya MB Kolhatar Research Award in 2008. Her publications and patents, she's over 45 publications on cancer and Ayurveda in peer-reviewed journals and 9 patents in Indian and US formulations for treating cancer. She also holds a diploma in Ayurvedic dietetics, which is done in 2005. To welcome you, Dr. Vinita Deshmukh.
Yes. Thank you for introducing me and giving me opportunity in this conference.
Thank you. It's a pleasure to have you here. Next, I move on to our the next panelist, Dr. P. Ram Manohar. He's done his MD in Ayurveda. He's the research director and Ayurveda expert at the Amrita School of Ayurveda. He has research interests including clinical research, network pharmacology, and whole medical systems research. He's received several awards for his contributions to Ayurvedic research, including the Ayurveda Ratna Award, the Dhanvantari Award, and the Dr. Keshav Balaram Hegde Award. Healing Honor, where he's a research advisor for the Indian National Science Academy, a member of the Scientific Committee of the National Institute of Ayurveda, and a member of the WHO expert group for Ayurveda. He served on the COVID-19 task force for the government of Kerala. He comes from a family of Ayurvedic practitioners and Vedic teachers in India as well. It's a pleasure and an honor to have you on as a panelist today. Welcome, sir, Dr. Raman.
Thank you, Dr. Pavitra. Thank you, Dr. Pavitra, for the introduction and the invitation to participate in this panel discussion. I'm honored.
Thank you, sir. Next, we move on to our moderators for the day for the panel discussion. I would like to introduce Dr. Pratibha Shah. She has her BMS MD Ayurveda and an MPH from the US. She's an internationally renowned Ayurveda expert, intensely trained in traditional health sciences as well as public health. She distills Eastern wisdom with an understanding for Western principles for the best care. She has initiatives in the field of Ayurveda have brought her to attention at the White House, the Department of Health and Human Services, as well as the Consulate General of India, New York, NYC. She was nominated in the top 20 Women of the Year for the year 2014. She is the founder and president of the Holistic Health Alliance and Global Council for Ayurvedic Research and CEO of My Ayurvedic LLC. It's an honor and pleasure to welcome Dr. Pratibha as a moderator for this event. Welcome, Ima. And next is just Dr. Mahadevan did talk about me, so just like a recap of who I am, and I'm also a moderator for this event. I currently am an internal medicine resident, but I'm going to be a resident physician into radiation oncology. I also have a Ayurveda degree, BAMS, that I did in India, where I worked as a senior medical officer at ESIC PJMSR for about 10 years. I have keen interest on integrative practice with special interest in oncology, using my expertise in both Western and Ayurvedic medicine. I've also presented and published several research papers, including in US and in India. I am also involved in conducting community outreach activities to promote healthy living through Ayurveda. That's the introduction about me, and now we can move on to the panelists right now. So let me begin with the first question for the panelist today. It will be to Dr. Santoshi Narayanan. So what role do you think Ayurveda can play in the management of cancer patients? Over to you, Dr. Santoshi.
Thank you, Dr. Pavitra, and thank you all for joining. It's such a pleasure and honor to be here with all esteemed experts in the field.
Sorry, if I may just 1 sec. Sorry for the interruption, but if all panelists can respond in 4 to 5 minutes, that'll be appreciated. Thank you.
Thank you. I will finish within 4 minutes, but I wanted to say thank you again all for joining. And regarding the question that you asked me, what is the role of Ayurveda within cancer care? So I think Ayurveda has multiple roles to play. First of all, I would clarify that I practice integrative oncology, so I'm coming from the conventional background, but I have a deep interest for Ayurveda, and I've been wanting to learn, and I'm doing a master's in Ayurveda, and I'm graduating in June. So from the limited knowledge of Ayurveda, what I have learned over the years out of my own interest and my master's program is that I see Ayurveda playing a role in multiple aspects of cancer care. And one of the key aspects I see is even before the cancer happens, like cancer prevention. So at MD Anderson, we have a cancer prevention department where we see a lot of patients who are wanting to prevent cancer, actually. So I think that will be a very good place to get our patients, see what is dosha imbalance that they have, what dietary modifications we can make, what other techniques that we can offer from Ayurvedic methods. So that will be a good population. And when they get cancer, I think there are several roles, several areas where Ayurveda can play a role. One of it is symptom management. And as we all know, cancer patients going through treatment, conventional treatment, they go through a lot of adverse effects. So Ayurveda can play a role in reducing the adverse effects because there are so many techniques that can be used for these two type of patients. And that in turn will help improve their quality of life. Quality of life is impaired, as we know, for a lot of our patients. So that is one area where I think Ayurveda can play a key role. And then one of the things that I see often patients come to me as an integrative medicine physician is they want to detox. And in conventional medicine, we don't have good detox options for them. So patients are often left going through their own methods, their own ways of detox, and they're kind of lost. And I think Ayurveda has safe detox regimens, which can be studied when cancer patients, made sure that it's compatible with their current treatments, and that will be very valuable for our patients. And lastly, I think once they finish the treatments in the cancer survivorship, so even after finishing the cancer treatment, the cancer survivors are left with a lot of adverse effects that they have to deal with. And in those areas, Ayurveda has a major role. We can help them deal with the adverse effects that has come as a result of cancer, help them get back into health. And helping them get back into health, I think, is one area where conventional medicine focus can be a little more better. And I think Ayurveda has so much more to offer in that area to get them back to restore their health, which is focus of Ayurvedic methods. So I think cancer is the spectrum or the continuum is a long-term issue, and Ayurveda can help in each and every area in the life or during the cancer continuum that patients have to go through.
Excellent. Thank you so much for a short and brief overview of what we can offer as an Ayurveda physicians using the principles of Ayurveda and wherein the roles of Ayurveda can play in different cancer care, from the prevention to the detox level. The next question I would like to ask would be to Dr. Nitin Kochar. Again, I didn't do the housekeeping thing earlier. Apologize for that. Please respond in about 4 to 5 minutes for this question as well. Please provide a few commonly seen cancers in your practice and your thoughts on expanding research and managing those cases with Ayurveda.
Yeah, so in my practice, I generally see patients, those who have already completed the chemotherapy and there is a relapse, or already those who are diagnosed in a little later stage with the metastasis, and there are very poor, the chances of survival already advanced, such kind of cases I do get referred from various my colleagues from the field of oncology, modern medicine, and also, from mouth to mouth patient, they will come to me. So what I feel, what Ayurveda, as Dr. Santoshi Narayan rightly said, onco prevention is the best role what Ayurveda can play. Okay, so at 3 districts, Ayurveda will play a very important role. One, to reduce the burden of chemo-resistant cancer stem cell. Now, in the Journal of Seminars in Cancer Biology 2020, precisely, an article has been published and they have said that chemotherapy is a double-edged sword. It has got pro-metastatic effects also. So during the chemotherapy, one has to reduce the burden of this cancer chemo-resistant stem cells. Okay, because in future, these chemo-resistant stem cells are going to recur, going to relapse, going to spread. So this is at 1 district we have to play role. Second district is to prevent angiogenesis. Chemotherapy also makes angiogenesis possible, and because of which this chemo-resistant cancer stem cell, there is an intravasation and extravasation. So cut off the angiogenesis, which will reduce the nurturing of the cancer cells. And at 3rd district, that is at the tissue level, to improve the strength of that distinct tissue where cancer is going to localize and going to grow further its strength and destroy the tissue and destroy the person. So at that 3rd district, to improve the tissue strength. So these are the 3, where Ayurveda definitely can help. Research is going on, but what I feel that we are not considering the principles of Prakriti. Let me give you in a very short. Vata Prakriti people is prone to develop very fast damages. Okay. And because of which there is a genetic rewiring so that there is a high proliferation. So if some Vata Prakriti patient of the cancer comes to you, one has to arrest the fast proliferating rate. For that, you may use a drug which may not be anti-cancer per se proven in the laboratory. I may use Maharasnadi Kadha, 26 herb preparation. I may use some other Kadha, according to that Prakriti and Sub-Prakriti. Then, Pitta Prakriti people, they have high expression of EGLN1 gene, because of which they are little hypoxic. And in order to overcome that hypoxia, there is a capillary angiogenesis. So Pitta Prakriti cancer patients, they have high rate of angiogenesis. So use something. You can use Adathoda Vazaka. You can use Bhunimbadi Kada. You can use Sariva, whatever. Whatever is Pitta Shambhu. Use that. So that capillary angiogenesis is cut off. And Kapha Prakriti people, they have reduced intracellular thermogenesis. So tumor microenvironment is affected in Kapha people. If they produce lots of lipids, lots of, ama is being produced, and adhesion is very strong in Kapha Prakriti. So use something which will improve the intracellular thermogenesis. So use ginger, chitraka. They are very good. The efficacy of ginger has been proven on mitochondria. Chitraka has been proven. Okay. And there is a testing called 8-hydroxy-2-deoxyguanidase, 8-hydroxy-2-deoxyguanidase, which is a mitochondrial marker. So this is very easily tested by the urine. And if this is reduced, excretion from the urine, it means that mitochondrial function is improved. I have proven in multiple my seminars and talks that Agni and mitochondria are same. And in cancer, mitochondria plays pivotal role. One of the hallmarks of the cancer is, disturbed metabolism. In fact, mitochondrial dysfunction initiates the cancer process, and thereafter genetic proto-oncogenes are stimulated. So one has to improve the Agni, and this is how, at 3 levels, Ayurveda definitely can help. So this is my 4 minutes, 34 seconds answer. Thank you.
Thank you so much, Dr. Nitin Chatochar, for such a wonderful explanation of how Ayurveda could help with cancer patients. And I really like how you said about the basics, like the Prakriti being involved with cancer care. I really appreciate that. It's very informative too. Next, I'll go on to my question to Dr. Vinita Deshmukh. Please share with us your experiences of integrative oncology research and the future you see.
Thank you, madam. At our center at Wagholi, we are treating cancer patients since last 30 years. These patients are divided mainly in 4 groups. Group A is a group of patients who are opted for only Ayurvedic treatment. Patients in this group are very less, but there are some patients of various types of cancer who cannot take allopathic treatment or conventional treatment due to their old age or maybe due to some health issues. And these patients are opted only for Ayurvedic treatment. So the principle of Ayurvedic treatment in this group is to to restrict the growth of cancer. We call it as a Vyadhi Pratyanik Chikitsa. B group is a group of patients who are previously treated with conventional treatment, but now there is a recurrence. So the aim of Ayurvedic treatment in this group is Rasayana Chikitsa as well as Vyadhi Pratyanik Chikitsa. Group C is a group of patients who are opted for Ayurvedic treatment along with conventional treatment. So main aim of Ayurvedic treatment in this group is to minimize side effects of chemotherapy and radiotherapy. Whereas group D is a group of patients who are already treated with conventional treatment and now they are disease free, but opted for Ayurvedic treatment to prevent recurrence or metastasis. So the main aim of Ayurvedic treatment in this group is Vyadhi Pratyanik Chikitsa, Rasayana Chikitsa, and mainly Panchakarma Chikitsa or Panchakarma treatment. Because what we have observed that if the patients are treated with Panchakarma treatment along with Rasayana Chikitsa, their disease-free survival is definitely extended. We have published many case reports of aggressive type of cancer patients in various journals like triple negative breast cancer or pancreatic cancer patients or cervical cancer patients with lung metastasis or male breast cancer patients. These patients are very aggressive cancer patients, but they are treated with Rasayana Chikitsa and periodic Panchakarma, that is seasonal Panchakarma for many years, for 10 years, 12 years like that. And in these cases, we have achieved a disease-free survival, which is not reported, which is reported as very less disease-free survival. So at our institute, we are documenting these cases, such type of cases. Similarly, we are conducting some clinical trials on breast and oral cavity cancer patients, which are very common cancers in India. In breast cancer patients and oral cavity cancer patients, we are conducting clinical trials to minimize the side effects of chemotherapy and radiotherapy. These trials are over and now we are on the way of publishing this data. Similarly, we have conducted 2 clinical trials on triple negative breast cancer patients and BRCA1, BRCA2 positive mutated breast cancer patients who are treated with Panchakarma, Rasayana and Shaman Chikitsa for more than 5 years. And we have calculated their disease-free survival in case control clinical trial. And the results are very encouraging. The data is also under the view of publication. And one more important thing, what we have observed in our research, that the drug standardization is very important thing in the management of cancer, because many oncologists think that Ayurvedic medicines contain metals and minerals. So they may be harmful during the course of chemotherapy or after completing chemotherapy or radiation. They think that these medicines are hepatotoxic or renal toxic. So for that purpose, at our center, we have a Tata Trust funded drug standardization lab in which we are doing the drug standardization of all herbal, mineral, and metallic medicines with the yardstick of modern medicines and the CCRS guidelines we are following. And what we have observed that the Ayurvedic medicines, if they are prepared as described in our text, they are not harmful, they are not hepatotoxic, they are not renal toxic. Even we are using Arogyavardhini or Suvarnakalpa for years together, but if they are prepared properly, they are not toxic for liver and kidney. So while treating cancer patient, we have to take care of standardization of our medicine. That is also very important. And we have to use the yardsticks of modern medicine like animal toxicity studies, or we have to find out heavy metal analysis of all these medicines. So another important thing which I have to just make in during the COVID period, we have made one survey of 700 cancer patients who are taking Ayurvedic treatment for longer duration at our center. And recently we have published a paper in JIM about this COVID data. And what we have observed that during first wave, only 4% patient had COVID, whereas in second wave, only 9% patient had COVID. And it proved that Ayurvedic medicines, which are given for cancer patients for preventing recurrence or metastasis, they are not only useful for cancer, but they are useful for improving their immune system and to prevent these patients from other infectious diseases and non-infectious diseases. That means our Ayurvedic medicines, as stated by Dr. Kochar, they mainly act on Agni, Jatan Agni, Dhatavagni, and once the Agni is kept normal, the patients remain normal. They can fight against not only cancer, but against all diseases. So this is our experience in short in last 30 years.
Excellent, Dr. Vinita Deshmukh. It was really impressive, and we wish we could transform those clinical trials in the US also. It provided, just rightly you said about the drug standardization, which I hear all the time wherever I say that I had based from Ayurveda, they always talk about hepatotoxicity or renal toxicity. So it's really, really worthwhile to hear all your experience, and I really appreciate you sharing that. Thank you. Next, I move on to Dr. Ramanohar sir for his question, and it is, please share with us details of ongoing research in Ayur Oncology or integrative oncology, and the prospective research that can be done in the near future. I've heard all these from the rest of the people, but I would like to have your a niche area to expertise to come and talk about. Thank you.
Thank you. Thank you again. Thanks to Dr. Pratibha for introducing this term Ayur Oncology. I was very intrigued when I heard about that term. It's very interesting and very relevant, to use such a terminology to denote the emerging area of Ayurvedic research. But I think we need to make a lot of ground before Ayur Oncology really becomes, reality. On the other hand, I have also been involving a little bit with what's happening globally, and I understand that there is a great keen interest in this branch of integrative oncology. And recently, through my association with Dr. Santoshi Narayan, I had the opportunity to associate with SIO, and so there is a lot of discussion on Ayurveda can become part of integrative oncology. So I'm going to say a few things from both these perspectives. One is the status of Ayur Oncology and its prospects, And on the other hand, how Ayurveda can get integrated into the emerging movement of integrative oncology world over. For both to really happen, this will have to be research driven. And my general impression is that at this point of time, I won't say that no research is happening. A lot of things are happening. A lot of people are taking individual efforts, but it has not reached a kind of critical mass that it is able to make an impact. This is the paradox, because if you look at what is happening at the ground level, due to unmet needs and the free availability of Ayurvedic treatment in India, a lot of patients are approaching Ayurveda clinicians. And from our previous speakers, we know what are all the areas where Ayurveda is being applied for cancer care. The challenge is that this is not getting converted into research. So what we have is more of clinical medicine rather than medical research. And just clinical practice alone cannot drive the development of what we call as Ayur Oncology, or help Ayurveda get integrated, into the emerging integrative oncology scenario. So there is a real need to promote systematic research. And another thing which I have noticed, like even if you search on PubMed, we get about 1,000+ articles related to Ayurveda and cancer. And if you screen all of them, you will find that majority are in the phytopharmaceutical, approach bracket. That is, you're trying to look at Ayurveda through the lens of modern medicine and trying to understand which herbs or which compounds might actually be useful for cancer care. And there are many herbs. So the whole system approach of Ayurveda hardly gets focused when any research happens. So you have today, turmeric is so widely used. Cannabis, of course, is also an emerging, but not from an Ayurvedic perspective. We have herbs like ashwagandha being studied, Semicarpus anacardium, even Moringa oleifera, many herbs. Cardamom, I saw an article about cardamom and cancer, but these are all from the phytopharmaceutical perspective. So what is missing is, this is not matching with what clinicians are actually doing in their clinical practice. So what I think, so I'm not clearly distinguishing between what is happening and what should happen, and, talking about gaps and what we should do. I think one of the major things that should happen in the Ayur Oncology research area is capturing of data from actual point of care, from clinical practice. This should become much more widespread. We need clinical registries. We should encourage, identify Ayurveda clinicians who are successful in the management of cancer, and, encourage them to document their data. I know GCAR has initiated such a activity called retrospective documentation of cancer patients. They are making a nationwide database, but this is still not yet come out into the open. I mean, it's not yet publicly accessible, and the results are yet to be published, but it's a very important thing. Now, I know my time is running out, so so this is the first point that I wanted to make. So we have to go from the bedside to the bench. I mean, that approach in research has to be initiated. Yet another problem we have also found, it is very difficult. If you want to do cancer research, especially at the point of clinical care, we need collaboration and cooperation between oncologists and Ayurveda physicians. And especially in the context of Kerala, I have encountered a lot of challenges. We have not been able to set good clinical trials, into motion. Most of the studies that are actually happening are compromised in terms of rigor, in terms of study design. They are all done in situations, with a lot of limitations, that even though the studies get published, they don't make an impact. But one of the major things which has not yet been discussed is the concern not only about toxicity of Ayurvedic medicines, but the drug-herb interactions. What will happen most of the time in cancer care, Ayurvedic medications and treatment. Now, when it comes to lifestyle and other interventions, this is not a big problem. It is much more easier to integrate. So what I've also found is that if we do not, Ayurveda can offer the whole spectrum of herb lifestyle. But today at the level of integrative oncology, there's a tendency to look at non-pharmacological interventions because they are easier to integrate. The full scope of Ayurveda is not being recognized because there are not enough drug-herb interaction studies. And in our institute, we have initiated and we have done some preliminary interaction studies like with methotrexate and some Ayurvedic herbal formulations, cisplatin and Ayurvedic formulations. And we did find that there is some interference. So we need to have well-established protocols giving guidance on how Ayurvedic medicines can be used when the patient is already on, modern medications. So I think my time is up. There are many more things to say, but these are some of the pointers that I would like to highlight to make a beginning.
Thank you, Dr. Ramanohar. It was definitely an eye-opener regarding what kind of research we need to do and what is currently being done. And it's actually a good blend of how we should be taking it forward. And it's really nice because now that you are also involved in SIO, I think in future, hopefully we have more things happening in SIO as well. And with, now I move on I give Dr. Pratibha to come forward and take over the stage.
Thank you, Dr. Pavitra. What an interesting round. Wow. So many different perspectives and insights and inputs. So with the permission of my co-board of directors, I'm going to change the format. I was going to ask one single question, but I have so many points that I'm going to have one more round of direct questions, and then we will move on to one question and summary and conclusion, and Q&A, of course. So I'm going to start in the reverse order. I'm going to address Dr. Ram first. So Dr. Ram, you've made so many relevant points, but let me ask you, distill some of what you said into, I think, some important questions. Okay. So I had written about registry, you have talked about the CCRS registry. Do we have an idea, proposal for a registry that is accessible to clinicians directly and in the open domain? Is there an idea for it? Number one. Number two, we have clinicians here, right here on our panel, who are treating cancer patients. I would like you to comment on where do you see the gaps? They are talking about research, they're talking about documentation. And yet we have, on the other side, a frustration about lack of research. I would like you to talk a little bit about that. And then, of course, I'm going to come to the two experts who are doing some research or who have been involved with research in the past. So number one, I want you to talk about the registry. I want you to please address where do you see the gaps? And then the topic of drug interaction. I want to briefly ask a little more detail on that, because drug interactions is a field, as I personally understand, to be extremely complex. You cannot pick up every salt and every ingredient in every formulation and have a database for that. How do we even go about studying and documenting herb-drug interactions, considering that the field of integrative approach to everything is an emerging one? how do we address this very complex question in a realistic manner? In a realistic manner. And lastly, if you could comment on any Ayush leadership on this, because the question of collaboration and cooperation that you brought up, how does it happen without any patronage and support at the central level or the federal level? So I know that's a lot of questions.
There's quite a lot of things. I hope I can be brief. So first of all, about the case registry, I want to mention about an initiative that we have taken at Amrita. We have created an Ayurveda clinical case repository called AyurCell, which is not specifically focused on cancer, but there are so many attempts being made on documentation of clinical cases, and it's not been successful. The Ministry of AYUSH also launched the ACCR, the Ayurveda Clinical Case Repository, during COVID, but it did not take off. And we have also been trying to do this for many years. And in the light of our experience, we found that clinicians are too busy. Unless we give them some support, you're not going to be able to convert their experience into, documents. So the Ayur cell is based on the idea, like, it's very much like a medical transcription. The clinicians have minimal work. They can even record, their clinical case summaries, just submit case records to a team who will sit and convert them into a structured case report. This was an experiment. This was supported by the Ministry of AYUSH. And in the course of about 1 to 1.5 years, we were able to compile about 100 cases. Not only, it is presented in a structured way. The purpose is both education and research. On the one hand, the clinical cases, we made them into audios, videos, graphical abstracts, all those things. So it can be used by clinicians, students for learning. There's a lot of learning that can happen between clinicians. That it's very important that, clinicians get an opportunity to share what they are doing amongst themselves. This will help to. So that is one of the purpose of the database. And now we are going to the second phase. We really want to, increase the numbers so that this database can then become material for research. We could apply, AI or many other tools, to identify patterns. And this would inform this clinical content. So this is a resource that is already available. And of course, it's not focused only on cancer, but already we have classified all the cases that are recorded here under different specialties. So Ayur Oncology could be one specialty in AyurCell which will deal with only cancer cases. We already got a few cancer cases in this thing. So it's a question of reaching out to the clinicians. So what I find is whatever we do, a lot of effort that has happened so far is to create very elaborate case recording formats, and the more elaborate you make it, the more complicated you make it, the less, clinicians are going to be able to do it. So make it simple for the clinician. Tell them, just give basic information of what you are doing. It's the job of another team actually to sit and convert it into data. And so that model actually works. And so we have 100 cases because, 100 cases in 1 year is quite a, fast thing, because the first 1 or 2 years we had to build the platform. So cases could be collected only towards the end of the project. And so the second thing that you asked about drug-herb interaction studies, I agree that it is complex. But the problem is, so what should actually happen is it should begin with pharmacovigilance. Because in India, there is no way we can restrict patients from using combined treatments. Patients will decide it. They will go to an Ayurveda physician. They may ask for a medicine. They will take it. So the only way to know if there are harmful effects, the first level is pharmacovigilance. We have also an Ayush Pharmacovigilance Center at our institute. So we have become sensitized to this whole process, encouraging patients and clinicians, Even modern oncologists should be sensitized to always check if their patients are on, herbal and other supplements, and report if they see any untoward events. So that could be the starting point. So because right now, for example, we had one situation where a patient who was taking methotrexate took a Starbucks herbal tea, and there was some severe side effects after that.
Wow.
So then we picked up that herbal tea and methotrexate and did the cytochrome 450, analysis, and found that this herbal tea was interfering with the metabolism of methotrexate and making it more available in the body, increasing its toxicity. So we should come from the clinical side, because unlike globally, where first the guideline has to come, first research has to happen, then a combination treatment starts. In India, that's not the way it works. Patients are desperate. I mean, they are not having access to all the care. So people are actually, the practice comes first, and then research happens around it. So if we can bring pharmacoepidemiological surveys and studies, we'll be able to understand, we'll get a lot of clues on what combinations we should do drug-herb interaction studies. And this is, I think, we have to create a complex model. Why we have to do it is because patients are being affected. If nobody is combining it, we wouldn't have had to invest so much on, doing drug-herb interaction studies, because now people are using it. It's a priority because their safety is a matter of concern. So we'll need to go from in silico studies, in vitro studies, in vivo studies, and also reverse pharmacology approach, all these things. So there is actually scope for creating centers of excellence just focusing on drug-herb interaction studies. And it should be a network research. It's not just one institute, or we should encourage, researchers, PhDs, all to start working on these areas so that we have enough data. And I think Ayurveda shouldn't get reduced just to lifestyle and, because that's part of it. But, we can make a much more contributions if our medications are also brought into the scenario, which they're not just as supportive care, but in mainstream management of cancer care. If that has to happen, then drug-herb interaction study is definitely the way to go. The last point about Ayush initiative, I think the Ministry of Ayush has been trying to, support this. I think there is a oncology center itself now in the All India Institute of Ayurveda, and they are collaborating with other modern institutions. So the ministry is definitely trying to handhold and push this. But I think it's because of lack of sufficient background research and the first steps that we need to do, which has not yet happened. This is not taking off in a big way. It's not the ministry has not taken initiative. We also know that the Tata Memorial Cancer Center has now come up with a very big initiative, 100-bed hospital. And they are collaborating with CCRAS. Dr. Manohar Gundeti is, I think, going to lead this whole initiative. So all these are very promising. But I think this has to be primarily research driven, and that research has to happen from the scene of clinical, practice. And if those basic steps that I think I mentioned, because if those gaps are filled, then only this can take off in a big way. So I hope I answered your questions to some extent, Dr. Pradipha.
Oh, wonderful, wonderful, insightful answers. And I can already sense a part 2 for this panel discussion in near future, if everyone is willing, because I think there are more questions emerging from the answers, if that makes sense. So, and I think maybe this kind of discussion may lead to some kind of a curated outline of suggestions for the policymakers to maybe bring focus in a more specific way rather than a generalized way. Right now we are talking about many generalized thoughts, and there is scope for specificity in approaches in all of these areas, pharmacovigilance and bedside to bench and all of those kinds of concepts that we have. But thank you. That's really, really very helpful. Again, as I said, for 5 answers, we might have 10 new questions, but we will continue to move along. Dr. Vinita, thank you for sharing such wonderful information about what is happening at your center since past 30 years. That's very, very impressive. I would like to ask you to help us understand a few things. First of all, with so much data and what you said that you're continuing to monitor some of the patients even now, do you have any longitudinal studies that are under progress? Like we have the Framingham study here, the Black nurses, studies here in the US, which are just ongoing, So is there something like that going on? Second, when you have so much data, why are we hearing two different perspectives on lack of research, whereas we are hearing there's a lot of research? Where is that gap? Would you like to talk about that? And thirdly, have you seen any particular trends in successes in certain types of cancers and maybe not in certain types of cancers? And if possible, I know it's a lot, but if possible, could you also address the question of, are you seeing people continuing to take Western medications while they're on Ayurvedic? That's something also, if you have some thoughts on that. Over to you.
I will answer from reverse order. First, I will answer your last question, that in our center, what we have observed, that specific types of cancer are more responded to Ayurvedic treatment, like Hodgkin's lymphoma, which we call it as or leukemias. We can compare them with Sannipatik Jwar or Rakta Pitta. That means the cancers which are more related to Rasava and Raktavastotas. So these cancers are best responded with Ayurvedic medicines, and the response of Ayurvedic medicine in these cancers is like that specifically in non-Hodgkin's lymphoma or leukemias, AML or acute leukemias, there are more chances of recurrence. And if these patients are kept under Ayurvedic treatment for longer duration, their recurrence rate or metastasis rate can be prevented to a considerable percentage. So these are some few cancers. There are some solid tumors like pancreatic cancers or liver cancer, which do not have a good medicines in allopathy. They are also the cancers which are best responded to Ayurvedic medicines. We can't say that they can be treated completely, but their survival and quality of life can be improved remarkably with Ayurvedic treatment. Breast cancer, as we have stated earlier, aggressive type of breast cancer like triple negative breast cancer and BRCA1, BRCA2 mutated cancers. These cancers do not have a substantial medicine in allopathy. But in Ayurveda, if they are treated continuously with a long-term treatment, they are definitely responded well with Ayurvedic treatment. So irrespective of type of cancer, if we think about Ayurvedic principle in each and every case, the cancer patients are responded well in terms of improving their quality of life and extended survival. So this is our experience. Second question which you have asked, that you have asked about the gap that you are telling about the research at our center, and Dr. Manohar sir was asking about the research in about cancer. So main thing is that in our center also for last 30 years, we are treating cancer patients as a single patient, not as a research. Since 2015, we have started clinical trials on breast and oral cavity cancer. But apart from these patients, these 400 patients, remaining patients are not treated as the clinical trial patients. They are treated as a single patient. Maybe a patient of breast cancer, 10 patients of breast cancer can get 10 various types of treatment. It is not the thing that single treatment is given to all patients. So this is the main thing for Ayurvedic treatment. And I personally think, or our center thinks that uh, treating cancer patient not as a clinical trial, but as a different patient, or as a separate patient, is the best way of treating that patient. Because we have to consider Dusham, Desham, Balam, Kalam, all these things, and then only we have to treat this patient, and then only the treatment becomes successful. So it's not the thing that one formulation is good for pancreatic cancer, one formulation is good for liver cancer, or like that. So this must be the gap between clinical practice and research in Ayurveda. So that is the answer of second question. And the first question, what we are asking, we are documenting the data of our patient according to organs of cancer, like breast cancer or oral cavity cancer. And we have not reached till date to make the longitudinal analysis, but soon we will complete that phase. Now we are just documenting and doing we are making the entries of all these documents, and then we will analyze data slowly. And then we will, for example, in JM recently, we have published one paper on colorectal cancer. So it was a data of 420 colorectal cancer patients regarding the risk factors of colorectal cancer. Likewise, we are analyzing the data, and I think it will take some time because it's a big task, because Ayurvedic data analysis is not as easy as modern medicine. It has many shades. So it will take some time. So that this is the answer for your first question.
Thank you so much, Dr. Vinita. Those are really helpful answers. And I hope everybody feels a little more informed on what is going on. And, again, as I said, the more we hear, the more we have curiosity and questions on, how can we better maneuver this new emerging field in a way that all of these efforts can be brought together and can inform one another for even better, more targeted approaches rather than everybody working in their own silos. So thank you. Thank you for those answers. I mean, this is a very big topic, but let's see what we can do. So on to you, Dr. Nitin. I know you have lots of thoughts. I know your hand was up. But also if you could talk about your views on centralization, some of what we are hearing here, how we can centralize these efforts in, even if it's an idea of a centralization, we would love for you to share it. And a few thoughts on onco prevention as a structured offering anywhere. Is it being offered? You brought out some really important points regarding personalization, regarding dosha assessment in that particular type of cancer, what you are treating, how that helps. So really important points you have brought up. But if you could just go ahead and try and address.
Yeah, so what Ayurveda says that trilogy of Ayurveda, Hetu Linga Aushadam. So medicine should be like, it should be preventive, it should be predictive, it should be personalized, and it should be participatory. So these are the 4 P's which are very important: preventive, predictive, personalized, and participatory. So when I say preventive, I must be able to identify what are the causes. Many people come, they say we are not having smoking, we are not doing any kind of taking alcohol or this, that. In spite of that, there is no family history, there is no genetic history, and still we are having cancer. So one needs to identify what are the causes. You know, it could be possibly the overconsumption of the milk and milk products. It could be, the wrong combination of the food. And yes, I am seeing these kind of cases. This causes the triggers the cancer growth. Okay, so that has to be documented, and on a larger basis, it has to be treated. It has to be educated to the modern doctor also from their first year of course or second year, whenever it is possible, to give the emphasis on the diet, and especially diet during the chemotherapy. So preventive, predictive, these are the things. I do agree with Dr. Ram Manohar sir, whatever said, and there are two trials are published which I recollect, that ashwagandha was used along with sorafenib in papillary and anaplastic thyroid cancer. It is published in American Journal of Surgery 2012. And the necrosis was almost 89% as compared to only when sorafenib was used. Another trial which was used in a benzopyrene-induced experimental lung cancer, it was published in somewhere in 2006, effect of paclitaxel along with ashwagandha. And again, they saw that reduced tumor cell proliferation and animal survival improved, immunocompetent cells, immune complexes, and immunoglobulin. So immunity enhanced and side effects were less. At our center at Tata Hospital, we have done trial on efficacy of curcumin in preventing the ADRs of gemcitabine, mucositis and plantar fasciitis and all other rashes. So they were all prevented by giving the curcumin. So these are the things. Safety and efficacy of cannabis has been established well in Tata Hospital. At my personal level, at my clinic level, I have used cannabis, mainly CBD, not THC, almost to around 2,000 patients. I may be probably the highest one using in Maharashtra, if not in India. And out of which 460 patients are of, cancer patients. Those who have definitely come to me in a late stages, I'm not able to help them much. But those who have immediately came after completing the chemotherapy and surgery and radiation, so they are continuing. As Dr. Vinita also said, sir also said, the quality of life is much better in all these cases. Last year, Dr. Badwe sir, in an open conference held at ACTRAC, that is Advanced Center for Treatment, Research, Education in Cancer, he said that the doctors from the other pathies, alternative pathies, and modern doctor, they should come and sit across, and we should find out where our reductionist approach is failing. He openly accepted with a large mind that when this reductionist approach is failed, one has to understand the holistic approach. And let us sit together, let us understand the principles of Ayurveda, and we can fill in the gaps. Dr. Manohar sir said about, the cytochrome P450. Yes, if you calculate cytochrome P450 of Pitta Prakriti, they are having low amount of cytochrome P450. That's why the drug metabolization doesn't happen and drug accumulation is fast. So side effects are more in Pitta Prakriti. Wherein Kapha Prakriti people, they have high amount of cytochrome P450. So drug is metabolized very fast, and that's why you need a higher dose. So before starting chemotherapy, like what you are examining patient, the data, the vitals and all, if you are able to find out about this molecular testing, about cytochrome P450, about the mitochondrial markers, that will be really helpful. Like sir in his one of the examples said that person had the herbal tea from the Starbucks. Possibly he may be a Pitta Prakriti patient. So that might have reduced further his cytochrome P450, because most of the herbal medicines, they contain ginger or, other kinds of green tea, and they reduce cytochrome P450. So side effect will increase. So this could be very valuable, input if you include Ayurveda, and that makes, participatory treatment complete. So Hetu, Linga, Aushadha, Trivida, the one which is a trilogy of Ayurveda: preventive, predictive, personalized treatment, Vayu, Pitta and Kapha, and participatory. So all these 4 P's, can be dotted together and we can complete the treatment. Thank you.
Thank you. Thank you. I think you all are. First of all, I want to thank you for sticking to our suggested, requested time limits. That's really helpful to keep moving along. But you're also sharing a lot in that limited time. So thank you, thank you, thank you for all that. So now, Dr. Santoshi, we would love to hear from you You had talked about some interesting suggestions of in the preventative areas, in the supportive areas, how we can use Ayurveda. I think uh, from a personal standpoint, I feel that these conversations have been going on for a long time. I think the role of Ayurveda in support, prevention, post chemo, etc., has been recognized for a while now. My question to you is, can you shed some light on how to actually practically go about the process and actually get these things into the integrative approach? Because they have been just floating around, but the integration has not happened. Everyone talks about it from both sides, but it has not happened yet. So somebody who is sitting on in a position, who is open, who is interested, who understands some of these trends, I would love to hear from you. First of all, has that integration really happened anywhere? And if not, how can this be facilitated? What could be some of the steps? Thank you.
Thank you for that excellent question. I think from my perspective, the integration is happening as we speak. I think where we were probably 10 years ago, and I have spoken about these areas 10 years ago, and it will go nowhere. But where we are now, and I think you have made a major step. You were represented in NIH NCCAH coalition. So that is a major step. The integration is happening. And then the foundations of integrative oncology. Integrative oncology as a field was in a very preliminary stage, like 10 years ago. But now there are several integrative oncology physicians and providers. I'm one of the integrative oncology physicians, where we integrate non-conventional approaches to conventional cancer treatment. So then there is this interest of how practically, and this is being discussed and thought about. And when I met Dr. Ram Manohar in one of the SIO conferences 3 years ago, we talked about it. Like, how can we make these words into action? So we actually developed an Ayurveda special interest group within the Society of Integrative Oncology, brought together a team of experts like how you're doing. And these things are happening because there is a lot of interest in making sure that this integration happens and it's brought to the practicality. But where we think that we need to go forward and make a difference is that in terms of bringing this in an evidence-informed manner. And this is where, like how Ayurveda, we are kind of seeing why it's not happening in every place. Integrative oncology is also in a similar situation, but I think a little bit ahead because it was started earlier. I think these kind of collaborations is the key. So I would like to just give an example, if I have one or 2 minutes, is recently we actually saw a patient in MD Anderson where there was a lot of interest in Ayurveda from the patient's perspective. And there's a lot of interest from my standpoint to offer Ayurveda for this patient. But we have medical legal limitations. We have several limitations to consider as well. So we did what we could within our limitations, but we also collaborated with Dr. Ram Manohar. We had a Zoom call where we had the patient, myself, and Dr. Ram Manohar, and we combined together and came up with a treatment plan. So we made this integration happen. And then Dr. Vinita Deshmukh described how integration is happening within center, and we have the Ministry of AYUSH trying to make this happen, the registry protocol. And then I think the guidelines will come in the future. So if there is enough data that is being gathered currently, it will come in the future. I also understand that Ayurveda has so much evidence, which is based on years of practice, like 5,000 years of practice, the most ancient and traditional and things like that. But when we have to take it globally, when physicians like me, when we want to do this for our patients, the evidence makes sure that our hands are not tied. So having some evidence helps us communicate with our colleagues the power of Ayurveda, what we can do for patients. So we can talk kind of the same language. But I also feel, and I agree with all of you, that the type of research should not be similar to what we do in conventional medicine, where we study one drug with one outcome. Because in Ayurveda, as many of you, Dr. Nitin and many of you mentioned, those are specific changes or a lot. So we cannot just group all patients, randomize them into two groups and study them for one drug and then one outcome and say. And thirdly or lastly, I don't see that the way Ayurveda is going, it should not be something that a conventional physician just learns and incorporates in their practice. But I see this like, for example, Dr. Pavitra, you're going to be a radiation oncologist. You don't practice medical oncology. The medical oncologist doesn't do radiation oncology. So rather, a collaborative model where we have an Ayurvedic physician, an integrative physician, and a conventional medical oncologist, and trying to come together, what is the best plan of care, which we already do in cancer. So that's where I see the field moving. I think it's happening, and the future is bright. And I know we're all working hard. We're all trying to form our own silos. But meetings like this that you have put together, we are learning about each other. We are learning about Council of Ayurveda Research. We're learning about Ayurveda Special Interest Group. So I think a collaboration between everyone in this field is the key to collectively move this field forward. So we can actually take the practices and the rich knowledge of Ayurveda to cancer patients, not only in India, not only in US, but in the entire world. I think that's where I see we are going. I think we are headed in the right direction. The momentum is there, and I think we will get there. The time is, it's going to take time, but I think we are going to get there. But thank you for that question. And I really enjoyed being in this panel with all of you. And I really appreciate it. Thank you.
Thank you so much, Dr. Santoshi. I was going to ask you more follow-on questions, but I think you have ended on such a note of hope. And I understand that, I think we all understand that this is an emerging model, and this model will take time due to all of the barriers and challenges that you have mentioned, medical, legal, and, other types of like policies are not in place and all that. So I think you have already outlined some of the barriers and challenges in terms of, the RCTs may not be the model and all that. That thing is coming together, which is what is reflected in a whole person research coalition, you know. So yes, so let's see what future holds. And we all are going to contribute to shape that future. That is the important thing. So let's all keep doing what we are doing. Now, on to the very final question, which will be a common question for all panelists. And this time we will move around in alphabetical order, if that's okay. First name alphabetical order. So Dr. Nitin will answer first, then Dr. Ram, Dr. Santoshi, and lastly, Dr. Vinita. So the question is, if you could comment on, what do you think are some of the innovations or new type of approaches, new treatment approaches, prevention approaches, anything in the field of innovation and emerging that you are, a part of, or you're witnessing, or we would like you all to share in maybe 3 minutes or so for all our attendees, so that we are aware of, okay, this is new and emerging, which, we were not aware of. So Dr. Nitin, we'll start with you.
Yeah, so it may not be new, but the evidences which I have seen, witnessed, and experienced myself in my clinic, that once I shift patient to the vegan diet, many people are afraid of, there will be a protein loss and bone loss and calcium loss, but surprisingly, nothing is happening. And vegan diet is definitely helping cancer patients and also to the other patients. So this is something very important. Okay. A lot of milk and milk products, they have got inbuilt, forget about the animal cruelty, but they have got a lot of inbuilt hormones, growth hormones, and which actually proliferates the cancer cells faster. Okay, so the shifting patient to that. Then controlled fasting diet, which is written in Ayurveda itself. If you give this kind of controlled fasting, there are a lot of research is being done, short-term fasting, long-term fasting before the chemotherapy in USA itself. So they have actually prevented the side effects of the chemotherapy. Bone marrow suppression has been, reduced, and patient can complete the chemotherapy with the great help. So these are the things, if we incorporate into the cancer patient treatment, it will be definitely having a good impact and positive outcome. That's what I think.
Excellent. Excellent. Thank you so much.
Thank you. Thank you.
Dr. Ram.
Yes. So, I don't want to talk about novelty because cancer is such a dreadful disease. Once I was attending a conference and somebody was telling it's a drug development meeting and cancer is the next big opportunity. I was completely shocked. Cancer is not at all an opportunity. It is a dreadful disease. And so my feeling is our focus should be completely on patient needs. We have to take a patient-centric approach. And there, what is really working for the patients? This is where Ayurveda can inspire. Even small things like we found in our hospital, peripheral neuropathy, or mucositis in the patient while they're doing chemotherapy. Even small things, not able to sleep properly. If we are not able to address the agony that the patient is actually going through in this disease, I don't think we can call it as any innovation. We don't have to look at big things like, making a big, so the whole focus should be on patient-centric care. And this is where systems like Ayurveda come in, because Ayurveda is entering into cancer area itself to address unmet needs. People are coming to Ayurveda to address unmet needs. So if we can make a list of, there was one paper that I read some time back, which made a list of unmet diseases with most unmet needs. And cancer stands out as the most prominent. Majority of the cancers have a big list of unmet needs. So I think those areas, if we can identify, find out those unmet needs where Ayurveda is able to offer the most, that would be the breakthrough. These are the areas where we should bring in, and it should not be just at the level of research. I mean, we should create guidelines. My dream of being associated with SIO is that, we should have a ASCO guideline, which incorporates Ayurveda, so that people globally can start accessing. That, I think, would be the biggest breakthrough I would be looking for.
What is that guideline? What did you say, Mechi?
ASCO guidelines.
What is the full form?
American Society of Clinical Oncology.
Yeah.
Okay. Thank you so much. Thank you, Dr. Ram. Dr. Santoshi, next. Thank you.
Thank you. I echo Dr. Ramanohar. I think cancer is such a dreadful disease, and I see only cancer patients in my practice, and it is awful to see how much they go through. So I think one of the things that I feel, it's not necessarily in a negative way, but what I should see that the field is going in, it should go in an innovative manner, is knowledge. I think the knowledge of Ayurveda has to be passed on to everybody. Like, a lot of people don't even know that there is something called Ayurveda. So guidelines will help, but we also need to create enough evidence for the guidelines to happen. So we have in the SIO, Society of Integrative Oncology, we have a guidelines committee, and we partnered with ASCO, American Society of Clinical Oncology, and there is ASCO SIO guidelines. But these guidelines are coming based on several studies. And if you look at my recent paper on review of our practice patterns, we actually described our patients and how we treat them from an integrative oncology model, which is what several of you are already doing. So these actually preceded the guidelines. But when the guidelines came, what we were doing before the guidelines came were consistent with the guidelines. So in Ayurveda, that is how I envision it. So you're all creating these data base, and you're all collecting information. And I think that when you publish it, people in all over the world can see it. And this will form the foundation of guidelines to have more structured approaches, to have more studies. And I do not expect that we are going to have high quality evidence, which is similar to integrative oncology. When I say high level of evidence, there is some definitions for moderate degree and high degree of evidence based on the type of studies. Having multiple RCTs is high level of evidence, and we don't need to get there. I think even moderate level of evidence, people are able to practice. So that is where I would be focusing for innovation to happen. So getting the knowledge, the basis of Ayurveda, what is Ayurveda and what can it do for conventional physicians, can take the field forward in multiple folds, even starting from India. And I trained in India. I did my residency in Michigan State University in United States, but my medical school was in India. And when I'm talking to my classmates, when I'm talking to other doctors in India, I think there is still a deficiency in knowledge of Ayurveda. So taking the knowledge to conventional physicians in India, in the United States, everywhere, is the innovation that will bring about change in the mindset. And that would actually create a true collaboration. And then having the databases and all of your work and so many people who are not here or all working as we speak. With all of these work, I think there will be guidelines in the future, and that will actually help us move this to make sure that the patient that we see or we care for is getting the benefit of all this discussion that's happening. Thank you.
Thank you. Thank you. Thank you, Dr. Santoshi, for that very, really, I would say, thought-provoking response. Before I move to Dr. Vinita, this is to the audience. If you have any questions, this is a good time to share it in the chat. We will pick up the questions from the chat, please. Thank you. Dr. Vinita, would you like to answer this question? Oh, you're on mute. You're on mute.
Hello. Okay. My perspective on this topic is that we have to treat cancer patient as an individual. There should be a personalized approach, as mentioned by Dr. Ram Manohar. And this personalized approach is not only for Yukti Vyapashray Chikitsa, but Sattva Vajay Chikitsa is very important for cancer patients. And if you listen from cancer patients about conventional treatment, there is a heavy burden of cancer patients on the oncologist, and they cannot give much time to cancer patients apart from their treatment expertise. So we Ayurvedic people should give more time to cancer patients, to counsel them, to counsel their families. So Sattva Vajay Chikitsa is very important, and we have to build up a relationship between them. So giving medicine is one part of our treatment, but giving support is very important part in cancer management, and that we can do. Well, allopathic doctor, they do not have some enough time to do for that. But if we treat cancer patient with the help of 3 types of treatment modalities, that is very beneficial. So patients should be in touch with us. They can call us at any time. They can cry with us. They can share their problems with us. And that is the main thing of, or that is the beauty of Ayurvedic treatment, that we should become a support system or family members of this patient, and that is very important thing. Second thing which I have to share, that the treatment of cancer should be scaled up, and I think Ram Manohar sir will be agree with this, that in allopathic hospitals or allopathic cancer hospitals, with the support of Ayush or with the support of government facilities, the Ayurvedic OPDs or Ayurvedic IPDs should be started, because it will, if we will see that if we are treating cancer patients in India, the percentage of cancer patients which are taking Ayurvedic treatment is very less. The other patients, they are deprived of the treatment facility, or they are deprived of the benefit of Ayurvedic treatment, and that can be covered, that can be overcome by starting various OPDs at allopathic hospitals, allopathic cancer hospitals. And I think we should not go more in detail about drug and hub reaction, because in our center, what we have done, that we have analyzed our data retrospectively, and we have seen that cancer patients who have taken chemotherapy and Ayurvedic treatment and continued it for longer duration, we compared their data with historical data. And what we have observed that there is difference in outcomes of disease-free survival, those who have taken Ayurvedic treatment along with chemotherapy till that period only. That means there is no drug and herb reaction. So if we will go in detail about that, many people will deprive from Ayurvedic treatment because allopathic treatment, which is in the form of chemotherapy, is very aggressive and it has many severe side effects. So if we will go in detail or we will waste our time in doing the analysis of this drug and herb reaction, I think many people will deprive from the benefit of Ayurvedic treatment. So that is my personal opinion. So these are the things which I have to share with all of you.
Thank you so much, Dr. Vinita. And I would like to request whatever publications you all have mentioned, if you could kindly share us via email.
Yes,
we
yes.
would love to share with our
Yeah.
database, which is a strong database.
Okay. I will
That
share
is,
my Google link in which all publications are there.
thank you. And I would love to get the same from Dr. Santoshi. I know she mentioned a publication, recent publication that would be helpful. Dr. Ram, Dr. Nitin. So please share your links, or if there is a central link, we would really, really appreciate that. So just to summarize, and before I share a summary, there is one question from the audience. Dr. Nitin, Dr. Vinita, everybody is, is welcome to answer that. So this is a question by Dr. Mukta Marathe, and she's asking, since we are talking about a personalized approach, should we also not develop a Nidana protocol for every type of cancer? That's
So
her question.
Nidana,
How would you like to
yeah,
answer?
Nidan, in Sushruta, there is a terminology word used by that Arbudadnya is there. At that time also, cancer specialist must be there. But Nidan per se to do only with Ayurveda, for me, it is difficult. I highly depend upon all modern medicine diagnostic methods. But what I do is a Prakruti Parikshan and decide the Avastha, Am Avastha, Niram Avastha, and accordingly I give the treatment. But per se, only Nidan protocol by Ayurveda is difficult for me.
Okay, so Dr. Vinita, go ahead.
Yes, I can answer that as said by Dr. Tusar. We have to rely on biopsy or PET scan or all these reports for the diagnosis of cancer. Right now, there is no confirmed method of diagnosing cancer only with Ayurvedic methods. So we can develop this type of tool with the help of retrospective data, but not prospective.
Okay, so Dr. Mukta, to your second question, I think you can reach out. They're all reachable. So you can ask that for your personal, whatever data you may have. Okay, their contact info is already there on our event page. So to summarize, I think what Dr. Nitin suggested is to explore the contribution of vegan diet and fasting, Langana from the Ayurvedic perspective, not necessarily the more recent types of fastings that we have, but the classical Langana protocols that we have. Dr. Ram talked about maybe not try to focus on any one big innovation, but rather focus on patient-centric care and quality of life, and try to bring in these parameters into the ASCO guidelines. And Dr. Santoshi talked about data-based guidelines that can be included in ASCO as a continuation of Dr. Ram's suggestion. And also a change in mindset and awareness in the minds of all of the people that are involved in caregiving, whether in India or in the United States. So awareness, which can hopefully lead to change in mindsets as well. Dr. Vinita talked about personalized care as being a strong point of Ayurvedic care, and Sattva Vajaya also to be considered on top of Yukti Vipashraya approach, and scaling up the treatment for cancer. And did I miss anybody? I covered everybody, right? Okay. So are there any last questions I see that Dr. Santoshi, may I request these on email because these are not clickable here. So yeah, thank you so much. I would appreciate it. Even if it goes to Pavitra, I know we were having some email issue. She can share with us. So if you could please share.
It's easy to kill cancer cells, but most difficult challenge is to keep cancer patient healthy and alive. That should be the aim.
Hmm. Yeah, and Dr. Amit is saying, how about cytoprotective action of Ayurvedic herbs? I think that goes into oncopreventive strategies. Oh, during chemo drugs simultaneously. Okay. I think there are, I remember because I had presented on something like this. Dr. Amit, I believe there are already studies on PubMed on ashwagandha, triphala, individually, all triphala fruits as well, guduchi. So there's really good data already on cytoprotective effect of herbs during the chemotherapy phase. So with that, I'm going to pass around for final thoughts in 30 seconds or 1 minute to all panelists, and then we will conclude the panel for today. So starting again in alphabetical order, maybe Dr. Nitin, you can go first.
Yeah,
Final
thanks
thoughts.
first of all the opportunity. As I already stated that it is easy to kill cancer cells, but the challenge is to keep cancer patients healthy and alive. And that can happen with the early diagnostic methods of modern medicine and oncopreventive methods of Ayurveda. We can bridge the gap. Yeah.
Beautiful. Thank you. Dr. Ram?
Yeah, what I feel is we must look at, because there's a lot of work to be done, and we should not get overwhelmed by too many agendas. So I feel what we should look at the entry points. Which are the areas where we can get started, where it's easy and possible to do research, and it starts creating evidence, and in incremental ways, once a few areas, for example, in Amrita hospital, we found after initially they were allowing only external treatments for collaborative purposes. But after 4 or 5 such interventions became successful, the oncologist is now willing to try internal medication. So we must find out a pathway and route which will lead to further development, not lead to a conflict or you get stuck planning very big things and not moving forward at all. I think that shouldn't be the.
Beautiful. Thank you so much. Thank you so much. That's a very practical suggestion, realistic. Thank you. Dr. Santoshi, please.
Thank you. Again, thank you for having me here today with all of you. What I would like to say is integrative oncology is one of the areas to begin with for Ayurveda integration. Because as you pointed out, Dr. Ram Manohar, to go with the area which is easy to focus on, to get into, is integrative oncology. Because a lot of conventional physicians are already open to this field. And I think that is where the integration can happen, because it is going to take both sides to come together. I think that's the future. That's where we can make this collaboration happen. And integrative oncology, bringing Ayurveda into integrative oncology is going to be along the lines of bringing the traditional medicine approach to conventional cancer treatment. So that is one way by which I think by education and research, we can bring this forward. Of course, there is a lot of work to be done, but I think it is happening. It is starting. It's going to. We all have action items. We are all working towards it, and let us all make this happen. I think the future is bright for Ayurveda, and I think we can help our cancer patients by true integration of Ayurveda and give the best of everything that we have for our patient who is in front of us, who is going through all of these things. So let us work together and let us all make this happen for our patients. Thank you.
Thank you. Thank you so much. Thank you. Dr. Vinita?
Yes, we all aware of the fact that prevention is better than cure. So till now we have treated more than 14,000 cancer patients. But after looking all these patients, a important thing which we think that prevention of cancer is very important. And in that sense, we Ayurvedic physicians should start wellness centers, and government also should support for insurance companies and everything to support the people to keep their healthy situation. And for that purpose, yearly panchakarma treatment, routine following diet and lifestyle modification, all these things are very important. And job of Ayurvedic physicians is to prevent diseases, dreadful diseases like cancer, diabetes, hypertension, and that should be taken into priority by private Ayurvedic physicians as well as by government.
Thank you so much, Dr. Vinita. So that brings us to the end of okay. Dr. Pavitra, could you share the GCAR email ID in the chat, please? And right now, I would also request Dr. Mahadevan, our other board of directors here today, to join the spotlight, please. Yeah. Okay. So these are all amazing, amazing suggestions. I think 1.5 hours is definitely not sufficient. We've already gone over almost 2 hours. This is an ongoing discussion, ongoing collaboration. We will hopefully have a continued pattern of meeting like this. We will try to summarize all of these points and send to the ministry. But I think for me, I think one of the areas of focus that I'm really interested and really passionate about is to focus on the Hetu part of the Hetu Linga Aushadam. Because a lot of cancer research is being focused on cures, whether it's at a genetic level and all kinds of cutting edge technology and things being brought in. But where are we on what is causing cancer, especially in the 21st century types of lifestyle foods that we have? What are the contributors? Because again, in Ayurveda, the beauty is that a lot of the Ayurvedic approach boils down to the basics in Ayurveda. And again, one of the very important basics of Ayurveda, the treatment basic, the first step is Nidana Parivarjanam. So while we are talking about the Aushadha part of it, where is the Nidana Parivarjanam focus in this whole conversation? So I think we need to also bring enough focus on the Hetu and investigation, research, documentation on the Hetu side of things as well. What are the oncogenic ingredients in our foods, in our environment? Certain things we can avoid, certain things we can't. The environmental ingredients or parameters we probably cannot. So anyways, I would probably we would be in touch with all the panelists again. Maybe there's going to be a part 2 in 2025, early 2025, and I really hope all of you will be willing to join again. We've kept this panel short. We've kept the panel time short, but I think we got a lot out of it. I hope the attendees got a lot out of it. The recording will be going up on our YouTube channel, will be shared across. So once again, from all of the board of directors of Global Council for Ayurveda Research, please accept our gratitude, especially to all the panelists. Really, really grateful for you to take out the time and share so many nuggets from your experience, from your vast experience, from your own vantage point in this whole process. I think it's been really, really enriching for all of us. And we might be making an attempt to summarize all of the points from today into a report. And we may reach out to you for comments on that report. and we may, hopefully find a good publication opportunity for the report. But we'll keep you all posted. So thank you. Have a wonderful day wherever you are in the world. If you're in India, have a great night. If you're in US or any other part, have a wonderful rest of your day. Thank you so much, and the conversation shall continue.
Thank you. Thank you very much. Wish you all have a happy and healthy new year. Thank you.
Thank you. Thank you.
Thank
Wish you
you.
the same. I request all the board members to remain, and everybody may kindly now leave. Thank you so much. Thank you.
Thank
Viewers,
you.
please remain.
I'll stop the
Bye.
recording. Yeah?
Yes, please.
I should leave, ma'am.